5 important causes for postmenopausal bleeding. Hello everyone, I am Dr. Ajesh Saxena, cancer surgeon, and today let us discuss some of the important causes for postmenopausal bleeding. Now, menopause is when your regular menstrual cycle has stopped completely and for at least a period of 12 months. And if you notice bleeding once your periods have stopped completely, this is what we medically call as postmenopausal bleeding. The most common cause that we see is a vaginal or endometrial atrophy. That means because of low estrogen in your body, the lining of your uterus and your vagina becomes very thin, and that causes dryness, it causes irritation, and is also responsible for bleeding or spotting. Now, the second important cause, endometrial hyperplasia. This is where the lining of your uterus becomes thick, what we call as hyperplasia, because of increased levels of estrogen in the body. That can be a simple hyperplasia, or when it has atypical cells in them, what we call as atypia. Now, this atypia can be again a pre-malignant condition for developing cancer in future. The third and the most serious cause is endometrial cancer. Now, 1 in 10 patients with postmenopausal bleeding can have an underlying endometrial cancer, and this is one of the more serious causes of postmenopausal bleeding which needs to be evaluated and treated timely. Now, fourth is there can be certain medications like blood thinners. People take hormone replacement therapies once their periods have stopped completely, and that unopposed estrogen can again be responsible for bleeding from the uterus. And then we have patients who are on tamoxifen, which can again be responsible for increasing the thickness of the endometrium and cause bleeding. Last but not the least, there can be other things like polyps in the uterus, there can be infections of the cervix, what we call as cervicitis, and all these can also be responsible for bleeding once the periods have stopped completely. So if you are experiencing any bleeding after your menopause has occurred, then please do not ignore it. It needs to be timely evaluated and treated accordingly. Not every bleeding is cancer, but we must make sure that we are not missing an underlying cancer of the uterus, and this is the most serious cause. Do like and share this video and help us increase awareness. Thank you.